This video will give you an insight into what to expect on rhinoplasty, facelift, neck lift, chin implant, facial fat grafting, and lip fat grafting.
Basic information, think about yourself, your address, like address in United States, right?
Sure.
Yeah. Okay, thank you. Just like for double checking, do you have like some kind of diseases like diabetes, high blood pressure, asthma, no hepatitis B, C, no, some allergies?
Allergies?
Yeah.
I had a cervical fusion, a C4 to 7.
Okay, but it's like inside of your body, so
Indeed, yes, it's all frontal behind my skin. And then I did have filler, let's see, I wrote it down, but it was last year I had filler a little bit on the sides of my lips and in my lips. And slight cheek filler as well.
because like why I'm asking you about like for example cheek fillers is because if you want to fat graft like in the area of the cheek, so like if some fillers are there, so we cannot like we should need to know like what we have.
Yes, exactly.
And let me check your blood pressure.
Hold it. Let's explain to me what you want. My face.
What I'm wanting is what I call my turkey neck to be fixed. These two lines, my muscle right here often sags, and I would really like to see a jawline. However, my concern is when I pull it back, I feel I have a very weak chin, and so I don't know if it will look imbalanced when I do this. Equally, my nose is quite long and has a hump, and so I'm really just hoping to restore some balance to my face. With that also being said, I feel my cheeks are a little bit flat right here, and so my concern again is just when I pull back, I love the look of this doesn't look so saggy, but I'm afraid I'm a little bit flat right here.
Do you want a fat grafter also?
Yes, please. Do you ever put fat into the lips?
Fat?
Do you do
Okay.
fat grafting into the lip?
Yeah, okay.
So I didn't know if that would be something you consider, if I would be a good candidate or not for that. My main concern though is this, like the face just being tight, lift, my nose, and right here.
Come close. Okay. Look at it. Your subject is quite crooked to the right side.
Patients can preview images of their post-surgical change prior to surgery through the 3D virtual simulation technology. Dr. Choi can thoroughly explain the process and the possible outcome through this. This is the part where Dr. Choi shows and explains the result of his previous surgical procedures.
Do you think this is white? Not so white? No problem.
I feel like I like the left side. I feel like the right side feels whiter for whatever reason. In general, it doesn't bother me, but if it comes down a little, that's fine.
When we wrap your hump, your nose bridge is more wider.
Oh, okay.
This is too wide at the end of the surgery. We will do the osteotomy to make the nose bridge more stable.
Okay. Yes, I guess I wouldn't want to go wider, but just kind of keep the harmony or the balance happening. Yeah, fantastic.
So we will do the rhinoplasty, chin implant, back graft, facelift, and neck X-ray. Do you want more volume?
Exactly.
Your lip is not so shallow, I think.
It's when I smile, this one tends to go up a lot, this side. And when I don't have any filler or anything, there's no volume. I love the shape of my lip. I just don't like how they get very flat. And where do you pull the fat from? That's my last question.
From your thigh, right through thigh.
Would I be able to request it either my stomach or my right thigh? No.
Usually your abdominal area, the fat granule is very large.
So we can
prefer here.
Okay.
The incision is very small, so usually here. So
Perfect.
What kind of surgeries like you will done for tomorrow? It will be rhinoplasty, yeah. So it's really like a little bit crooked nose correction, like T-plasty, and then long nose correction, double ostomy to make it a little bit narrower, and just like very hump resection. Okay. And then it's a facelift and your neck lift, right? With a chin implant.
Yes.
Okay. And then you also want to have a big fat graft. Yeah, the doctor told that is possible. And after the surgery, like your kind of result may be like slightly different that you will get like 6 months before, because like the final result we will see after 6 months, not just like after surgery.
Right. Okay.
You will provide it with an ice pack. You need to use it for 5 days, but do not apply the ice pack directly to your skin and not to fat grafted area. And after the surgery, it's recommended to sleep with your head elevated. So use like 2-3 pillows, like as much as you can. Just like not as much, but like 2 pillows will be okay. Yeah. While the tissues will be on your face, you cannot wash your face with water. So please put some tissues, like wet tissues, and just slightly clean it.
Okay.
Did you need to breakfast?
No.
No. And a drink?
No.